Hello everyone, welcome back to Speak Healthy. Today, we are going to talk about high cholesterol and how to control it. Hypercholesterolemia is a condition characterized by high levels of cholesterol in the blood, which can increase the risk of heart disease. This condition affects millions of people worldwide and can be caused by a variety of factors, including genetics, diet, and lifestyle choices. Fortunately, there are steps you can take to reduce your risk of heart disease if you have hypercholesterolemia. We will explore some effective strategies for managing this condition and lowering your cholesterol levels. From dietary changes to regular exercise and medication, we'll cover a range of options to help you stay healthy and reduce your risk of heart disease. Number 1. Understanding hypercholesterolemia. Hypercholesterolemia is a condition characterized by high levels of cholesterol in the blood. Cholesterol is a type of fat that is produced by the liver and is also found in many foods we eat. While some cholesterol is necessary for the body to function properly, too much cholesterol can be harmful and increase the risk of heart disease. There are two main types of cholesterol: low-density lipoprotein, LDL, and high-density lipoprotein, HDL. LDL cholesterol is often referred to as bad cholesterol because it can build up in the walls of the arteries and form plaques, which can narrow the arteries and reduce blood flow to the heart. HDL cholesterol, on the other hand, is often called good cholesterol because it helps remove LDL cholesterol from the bloodstream. Hypercholesterolemia can be caused by a variety of factors, including genetics, diet, and lifestyle choices. In some cases, people may inherit genes that cause their bodies to produce too much cholesterol or to have difficulty removing LDL cholesterol from the bloodstream. In other cases, hypercholesterolemia may be the result of an unhealthy diet that is high in saturated and trans fats, which can raise LDL cholesterol levels. Lifestyle choices such as lack of exercise and smoking can also contribute to high cholesterol levels. Over time, if high cholesterol is left untreated, it can lead to the development of heart disease. Heart disease is a term used to describe a range of conditions that affect the heart and blood vessels, including coronary artery disease, angina, heart attack, and stroke. These conditions can be life-threatening and are a leading cause of death worldwide. It is important for people with hypercholesterolemia to understand the risks associated with high cholesterol levels and to take steps to manage their condition. With the right treatment and lifestyle changes, it is possible to lower cholesterol levels and reduce the risk of heart disease. Number 2. Lifestyle changes. Making certain lifestyle changes can help reduce cholesterol levels and lower the risk of heart disease for people with hypercholesterolemia. The following are some tips for healthy lifestyle changes that can help manage this condition. Healthy eating. A healthy diet is crucial for managing hypercholesterolemia. Limiting saturated fats and trans fats is essential, as these fats can raise LDL cholesterol levels. Instead, opt for heart-healthy fats such as those found in nuts, seeds, and fatty fish. Increasing fiber intake can also help lower cholesterol levels by reducing the absorption of cholesterol in the gut. Foods high in soluble fiber, such as oats, barley, and fruits and vegetables, are particularly helpful. Physical activity. Regular exercise can also help manage hypercholesterolemia by increasing HDL cholesterol levels and improving overall heart health. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking or cycling, on most days of the week. Weight management. Losing weight if necessary can also help manage hypercholesterolemia. Excess weight can contribute to high cholesterol levels and increase the risk of heart disease. A combination of healthy eating and regular exercise can be an effective way to achieve and maintain a healthy weight. Quitting smoking. Smoking is a major risk factor for heart disease and can contribute to high cholesterol levels. Quitting smoking is one of the most important steps a person can take to improve their overall heart health. Number 3. Medications. Medications can be an effective way to manage hypercholesterolemia and lower cholesterol levels, especially when combined with lifestyle changes. The following are some of the different types of medications that are commonly used to treat hypercholesterolemia. Statins. Statins are a type of medication that work by blocking an enzyme in the liver that produces cholesterol. They are highly effective at lowering LDL cholesterol levels and can also lower triglyceride levels and raise HDL cholesterol levels. Some common examples of statins include atorvastatin, simvastatin, and rosuvastatin. Statins are generally well tolerated, but they can cause side effects such as muscle pain and liver damage. Bile acid sequestrants. Bile acid sequestrants work by binding to bile acids in the intestine, which helps to reduce the amount of cholesterol that is absorbed in the bloodstream. They can lower LDL cholesterol levels by up to 20% and can also raise HDL cholesterol levels. Some common examples of bile acid sequestrants include cholestyramine and cholestyramine. Bile acid sequestrants can cause side effects such as constipation and abdominal discomfort. Ezetimibe. Ezetimibe is a medication that works by blocking the absorption of cholesterol in the intestine. It can lower LDL cholesterol levels by up to 20% and is often used in combination with a statin. Ezetimibe. Ezetimibe is a medication that works by blocking the absorption of cholesterol in the intestine. It can lower LDL cholesterol levels by up to 20% and is often used in combination with a statin. Ezetimibe is generally well tolerated, but it can cause side effects such as diarrhea and abdominal pain. PCSK9 inhibitors. PCSK9 inhibitors are a newer class of medication that work by blocking a protein in the liver that regulates LDL cholesterol levels. They can lower LDL cholesterol levels by up to 60% and are typically used in combination with a statin. Some common examples of PCSK9 inhibitors include evolocumab and alirocumab. PCSK9 inhibitors are generally well tolerated, but they can cause side effects such as injection site reactions and flu-like symptoms. When deciding which medication to use, healthcare providers will take into account a person's individual medical history and current medications. They will also consider the pros and cons of each type of medication and how they can be used in combination with lifestyle changes. For example, a person with hypercholesterolemia may be prescribed a statin and advised to make healthy lifestyle changes such as eating a heart-healthy diet and getting regular exercise. By combining medications with lifestyle changes, it is often possible to effectively manage hypercholesterolemia and reduce the risk of heart disease. Number 4. Screening and monitoring. Regular cholesterol screenings and monitoring are important for people with hypercholesterolemia in order to track cholesterol levels and assess the risk of heart disease. Cholesterol screenings can also help identify the presence of hypercholesterolemia in people who are at risk but do not have any symptoms. The American Heart Association recommends that adults have their cholesterol levels checked every 4 to 6 years starting at age 20. However, for people with hypercholesterolemia or other risk factors for heart disease, more frequent screenings may be necessary. Your healthcare provider can help determine how often you should have your cholesterol levels checked. Cholesterol screenings typically involve a blood test that measures the levels of total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides in the bloodstream. These results can provide important information about a person's risk of heart disease. High levels of LDL cholesterol are a major risk factor for heart disease, as LDL cholesterol can build up in the walls of the arteries and form plaques. Over time, these plaques can narrow and harden the arteries, increasing the risk of heart attack and stroke. On the other hand, high levels of HDL cholesterol are beneficial, as HDL cholesterol helps to remove LDL cholesterol from the bloodstream and transport it to the liver for processing and removal. By monitoring cholesterol levels over time, healthcare providers can assess the effectiveness of lifestyle changes and medications in managing hypercholesterolemia. They can also adjust treatment plans as needed to help reduce the risk of heart disease. In addition to cholesterol screening, other tests such as C-reactive protein and coronary artery calcium scans may be recommended for people at higher risk of heart disease. Number 5. Dietary supplements. Dietary supplements are often marketed as natural remedies for reducing cholesterol levels, but it is important to understand the evidence behind these supplements and any potential risks or interactions with medications. Some common dietary supplements that are often recommended for people with hypercholesterolemia include plant sterols and stanols, omega-3 fatty acids, and red yeast rice. Plant sterols and stanols are compounds found naturally in plants that have been shown to help lower LDL cholesterol levels. These compounds work by blocking the absorption of cholesterol in the intestines, which can help to reduce the amount of cholesterol in the bloodstream. Plant sterols and stanols are often added to foods such as margarine, yogurt, and orange juice. Studies have shown that consuming 2 to 3 grams of plant sterols or stanols per day can help to reduce LDL cholesterol levels by 5 to 15%. Omega-3 fatty acids, which are found in fatty fish and certain types of algae, have also been shown to have cholesterol-lowering effects. Omega-3s can help to lower triglyceride levels and may also help to raise HDL cholesterol levels. Some studies have suggested that omega-3 supplements can help to lower LDL cholesterol levels, but the evidence is not as strong as it is for the plant sterols and stanols. Red yeast rice is a type of fermented rice that contains a compound called monocolin K, which is similar to the active ingredient in statin medications. Some studies have suggested that red yeast rice supplements can help to lower LDL cholesterol levels, but the quality of these studies has been questioned. In addition, red yeast rice supplements can vary widely in their potency and purity, and some products may contain harmful contaminants. It is important to note that dietary supplements can have side effects and may interact with other medications. For example, plant sterols and stanols can interfere with the absorption of certain fat-soluble vitamins such as vitamin E and beta-carotene. Omega-3 supplements can increase the risk of bleeding, especially in people who are taking blood-thinning medications. And red yeast rice supplements can interact with other medications such as cholesterol-lowering drugs and can also cause muscle pain and liver damage. Number 6. Future research. Research into hypercholesterolemia and heart disease is ongoing, and there are always new developments and potential treatments on the horizon. For example, new medications are being developed that target different aspects of cholesterol metabolism, such as PCSK9 inhibitors, which can help to lower LDL cholesterol levels. Other potential treatments include gene therapy, which aims to correct genetic mutations that can lead to high cholesterol, and novel drug delivery methods, such as nanoparticles, that can target cholesterol buildup in the arteries. It is important to stay informed about new developments in cholesterol-lowering treatments, but it is also important to remember that not all treatments are effective or safe. Before trying any new treatments or medications, it is essential to talk to a healthcare provider to determine whether the treatment is appropriate for your individual situation. In addition to new treatments, research is also ongoing into the causes and risk factors for hypercholesterolemia and heart disease. For example, researchers are studying the role of genetics, lifestyle factors, and environmental exposures in the development of high cholesterol and heart disease. By understanding these factors, healthcare providers can better tailor treatments and prevention strategies to each individual patient.